So I'm going to start the class shortly now. Let me just check this. So today we're going to talk about, we're talking about arthritis, obviously, but more about acupressure, how to prevent any kind of pain in the body. Acupressure was a good tool for prevention, for diagnosing your illness, and helping you to cure it as well. Gives you a real power at your fingertip. It's 100% safe. Do-it-yourself therapy. Acupressure can be used along with any existing treatment you're having. It assists the body in gradual restoring the natural healing mechanism in good health. When I was doing in Nairobi, one of the yoga teacher who attended my class, she was telling her story about her mom. She was traveling from Canada to Nairobi, and she had a stroke. So doctors more or less gave up on her. But she didn't believe that. So she took mother and she kept kind of massaging her feet and hand all the throughout within a week, the lady came back and kind of, she's alive, but the quality of life wasn't as before, but still better than before. No, better than dying kind of idea. So really, acupressure helps to promote good health, very important. So prevention is better than cure. We're doing yoga, everything, we're doing things. A lot of people wrote to me about the knee pain. I'll show you some simple knee pain exercise, but for me, for acupressure, you need certain tool. Obviously, one is obviously the pencil like that. And if you have this, and if you have a golf ball or a tennis ball, I don't have a tennis ball just now, so I'm going to use my dog's ball. So I need to be careful, otherwise he'll run after me. When I'm playing with it, he runs after me, kind of idea. So I'll use these tools to how to get the knee pain down for you. So most of us in life will have knee pain sometime in life. Because knee takes all the weight of your body throughout the year, throughout your lifestyle. So really you have to make sure people who are elderly, if the leg is not strong, that creates a health problem. So really need to be strong. You have to look after your knee. Our dog's here again. Sorry. Do you mind? I'll put you in the room then. He looked at the ball, that's why he's looking at the ball. He wants, is it as mine? I'll give, you'll have it. Come on, let me put him away first. Come on here. Come on. So your legs are very important part of the whole thing. And it's good to, before having a shower, heat some mustard oil and add some kapoor, camphor, and some candle wax. You can make it ready all the time in a jar and massage your knee like all over the top of the knee here, leg itself, to improve your circulation. And also obviously taking hot and cold shower, which I talked about anyway in the morning when you get up. If you do that daily night time before going to bed, massaging it like completely across there, all the top bone, all the side of your leg, that itself will improve circulation. And also it kind of energy flow around the knee. And the point are good for not just for knee, but for people standing all day and people who do a lot of exercise, a lot of walking, cycling, and things like that. Prevention is better than cure. That's what all is about it. One of the simplest exercise you can do is, you can do that best lying on the floor. The dog's going to run after me. I've locked him in the room. Hopefully. You need a tennis ball. I don't have a tennis ball. You bend your knee like this, like that. Put this tennis ball in your knee there, and you press this there and for 10 seconds. So what you're doing is you're using that as a pivot So you're stretching the top of the stretch, and that takes the pain away of your knee, gives you that kind of relaxation. And relax. Do the same thing with the opposite leg. I spent half an hour looking for a tennis ball. I couldn't find it. It's all. And relax. That's one simple thing we did. Next one, the knee pain is very important exercise is tennis ball, put on the floor, and then put your hand on it, feet on it, and then you can go back to it. And you rock it like that. Well, let me highlight myself, let me see it better probably. Just rocking you the golf ball. But usually tennis ball is better or something slightly bigger than golf ball. Both legs. That will also take the heel pain away. People were like standing all the time, things like that, prevention again. That's better. That's one. Next is very important point is the back of the leg. When you open the leg, just middle point, the back of the leg. So you can take the, if you don't have the gun, just use the thumb like this, back, and you press it. That's one of the best points, simplest, everybody knows what to do. And if you have the gun, all you do is set the setting, then whatever you can accommodate, and put that in middle there. The energy will go right down to the, you feel the vibration right down to the floor from that, just do that. That's one. Second is, if you look at the round circle, I've already done the marking on this field. You see all the marking there? This part of the bone there, the round thing. What you try to do is use the gun, if you have the gun, to press right round to activate more blood supply to that point. I have the knee problem in the right leg. I do that always. So more blood supply goes to where the currents are going in the body. And then what you do is you press across and you try to move across right way, exercise them up and down like that. And find which one is more paining, which movement is more paining. That's where the problem is. And you can do the cross like that. And then you press this point with hand. If you don't have the gun, no problem. Excellent. Good. Got that? That will help that daily. Second is the 2-eye point. When you go below that, there's a side of the bone, there's a 2-eye point. Pressing this massage with the finger, and if you have the gun, just pressing it each point for 20 seconds, 30 seconds itself. Otherwise, just do with the hand, no problem. I'll do with the hand today, and then you know the gun, you can use the gun on the same point. That's one. Second is, when you go to the bend the knee, when the toe to the middle, when you draw a clear line, in the middle, you go and you press that point. You find the tender spot. And the next is when you go to the top, you'll find the soft hollow bit there, just pressing that will release the knee pain. And it's very important to actually massage the top knee all the time like this, to bring it all right there. Because all the energy is flowing down there and it's got to come back up. Blood flow needs to be proper. So you can mustard oil and you massage it like you can do that anywhere at all, whatever you want. And these 2 points. You done down here. Now next is the eye point you've done. Now if you hold your thumb like this in the leg, like this, that's that point there. You can see this point, middle finger goes this point, eye point. And if you go in the middle, go below forefinger. And then go on the side, 1 finger, that point. Pressing at this. This is point S, stomach 36. This is called eye of the knee, stomach 35. That's 35, that's 36. And then also, next important point is, if you look at your leg, if you go to the liver point, where the thumb and next finger meets, that point. Liver point is good for everything. So far, so good. And then obviously, other point is the kidney point is just there. You know, where the bone, your thing is just outside that, pressing this. That's kidney point 3. And then in the bone, if you go forefinger above there, that's gallbladder point 39. You'll find it's quite tender, quite painful pressing it here. I'm sure these things, if you bought the pain, it's got all the meridian diagram. That shows you all the point where to put the things in. So really, and massaging your calf muscle, putting massage on it like all right in there. And also we do this exercise, all the channel on the legs. All the 4 or 5 channels, pressing it there, you release the pain. And also when you do low walking, sometimes what I do, hold my standing on the wall and bend your feet like this. Then your pain goes away. Just brilliant. You give that body kind of relaxation when you're tired, when you do low walking. You just take your feet up and just kind of press this. And that's what the tennis ball thing is. When you press tennis ball like this, that helps to promote that kind of thing. That's it about the, right. So what I will do is, I've talked about the knee today mostly. So what I like to do is, I open to any of you want to ask any question, so I can tell you what to do on whichever pain you have.
Shoulder and hands.
Right. What's happening with the shoulder hand is usually due to the posture problem. That happens to a lot of young people now as well. They're playing computer and things like that all the time, or iPad, or on the phone and so thing. So really, your vagus nerve goes from here back the ear side across. Also, your blood supply to your brain comes to the cut, one of the main veins to the top as well. So when your postures are right, everything is stretched. So it creates a less blood supply going to your brain. So your brain starts to degenerate. So that gives you kind of short-term memory loss. You become angry or you depress. And then you have frozen shoulder. I'm just telling you all the symptoms you will have. Carpal tunnel, tennis elbow, tingling feeling in your finger. That could happen right hand or left hand, depending which hand you're using. Back pain, cramp in your feet. And also, when you get up in the morning, the bottom feet of your feet will be burning sensation. And also affects your ENT, ear, nose, and throat. Your eye will water when you go out. Nose will get nose infection. Nose will run whenever weather changes, and throat, whenever weather changes, you have sore throat. These are because the lack of energy, lack of blood supply, so lack of oxygen going to your part of the body where it's required. To do that, there's obviously acupressure. I said to you, you design the acupressure in 3 sections. One is simple one, is this is your neck above, and that's your heart and things, and bottom is the digestive, excretory, reproductive system. That's one. Second was the one in the book, which tells you thorax, your stomach, eyes, lung, ear, and so on. And third is physiotherapy. You put your both hands there. That's your head, that's your hand, leg, hand. So this is how we designed it. So if you have a neck problem, if you do a physiotherapy, everything happening here on this neck. So if you have the pain, you can just use the pain to just exercise. That will exercise the whole part of the body here. Prevents the neck pain, everything. Just around the neck, around the stair. That will improve the neck function. If you don't have the pain, just rub it like that across. Couple of seconds each home, each couple of times. And second, obviously, if you have somebody else doing it to you, then he can put the gun here and put his other finger on the neck on the same side. So current will flow through his body. So he's like doing an acupressure at 2 points at the same time. And you feel the vibration in your neck. Your neck will start throbbing, it's like a moving around. And same thing in your hand as well. And together, you'll feel suddenly you can move your hand better. If you can't lift your hand up, your movement will come back. I've done it for hundreds of times. I know it works. But problem is, I'm trying to give you online training. Sometimes it's very difficult because when I'm doing it, I'm feeling your nerve as well. I can feel how the current is flowing, and I'm trying to send the energy through the meridian. Where sometimes people don't know they can. Wherever you find meridian, your vibration will be bigger. See, like if you do it there, nothing happening. When you go further in, suddenly my vibration will increase. Where I found the right meridian for my biggest nerve. Can you see it? Same as here. If I do anything happen, suddenly I go somewhere where I find the biggest nerve or my main nerve, energy channel, everything will start vibrating more. Same thing happens with thyroid problem. So that's why you have to find this finds energy channel for you in your body. Everybody is slightly different, unique. So one point is similar, but it may be slightly variation, very little. So doing it there, and also if you have a frozen shoulder, then also your spine put on the neck. That's why you do, and put my other hand on the spine where the pain is, and your pain will go away.
How many times? Sorry, sir. How many times? Sorry, how many times we can use the pen a day?
There's no side effect to it, but I will say up to 1 minute, and then 40 seconds to 1 minute, and then do every 3-4 hours, depending how severe the pain is. But the thing is, it's like taking a brufen tablet. This releases endorphin, and the pain goes away. That's the first thing it does. And second thing is it's also trying to cure it. Find out if the nerve is trapped, it's trying to untrap it, so you don't have the pain at all for good. But the problem is, once it does that, you go back and do the same thing again, so it comes back again. So it's like you have to. Once you know the problem, you have to kind of get rid of the problem. If you can't, because of the type of work you do, you have no choice in the matter. Then that's the issue you have to tackle yourself. That's nothing anybody can do. You have to but be careful. Just try to correct your posture, make sure you're not harming yourself as much as you did before. Now you have better knowledge, so you can actually make a right decision to make sure your posture is always right. That's why we did all the shoulder exercise. We do all those kind of exercise. That's what I've been doing to promote your shoulder, make your postures right. That itself will prevent frozen shoulder and all those pain. If you do that daily, I can guarantee if you have the problem, do it morning and evening, those exercise. Once your shoulder becomes posture like this, then you won't have any problem. And I find people who do pranayama, less blood supply going to the brain, but the amount of oxygen increases, they don't have the symptom. They might have the problem, but they won't get the symptom of tingling, feeling, tennis elbow, carpal. They all will go away. Otherwise, you'll end up with spondylitis in later life. That can cause the nerve trap in one side, so one side completely might not function properly. You can't move your hand, can't move your leg. That could happen. That's the worst scenario. I've seen a lot of people with that as well.
You do this in
How much?
empty
Oh,
stomach?
sorry, go on.
Sorry, do you use the pen on empty stomach, or you can use it?
No, that doesn't matter. You can do it anytime. Food doesn't matter. Food. Obviously, what you're trying to do, if you're trying to empty your stomach, like this morning, because last night I ate a lot of what do you call mungfali, both khali the, but it was snack. That's why I had a cramp in my feet and a lot of kind of gas in my stomach. So in the morning I had to put on my stomach point. So my bowel movement came out very good just by doing that. We had a lot of gas in my stomach. In the morning, when I did the Pawan Muktas, and a lot of gas came out. So I think that's the thing is, I kind of, sometimes you like something, you overindulge in it. That's the problem. Mind, mandi manta. जानता है मन नहीं खाना चाहिए पर मन नहीं मानता, मन खा लेता है, क्या करें?
How much kapoor you put in the mustard oil?
Just slightly, just I think obviously I'm not the chef. What you do is I just mix it until I find the right smell and something flavor comes out of it, kind of, you know, you can feel. And when it cools down, it becomes kind of jelly, like a jelly. So you put that in a jar and use that over a week or 2 weeks. You can use it, no problem.
Oh, you
Don't make it every day. You make it once, quite reasonable amount, and put that in a jar and do it. That's also good for heel cracking, crack heel as well. Prevention of heel cracking.
Can I just, what's kapoor is called in English? What's it called in English?
Camphor.
Oh, camphor.
You mentioned about the candle wax. Do you mix candle wax as well?
Yeah, just candle wax gives that kind of smoothness to the skin.
Okay.
Just a small amount. Just take a normal candle and just cut some wax. Just put melt into the when you're melting it. No problem. That's what I do. That's what I do anyway. But obviously, in India you can buy candle wax separately. But यहाँ पर तो मिलता नहीं है, so I just bought the candle, tea tree oil candle, and cut some wax off and put that into the recipe.
Okay. You mean candle wax in the oil?
Yes.
Really?
It melts all and then becomes a jelly. So it becomes like a cream. And you put that and then you use that for your crack heel, your skin problem, even knee problem. If your knee problem, put the paste on your knee, your pain will go away.
How much candle wax do you look like?
Warm it up first.
Huh? Sorry.
Warm it up all together.
Yeah. But other good thing I find for knee pain is, see, when you have a knee pain, what do the doctor prescribe you? Sulfadine tablet, isn't it?
Yeah.
Something to be sulfur. So if you look at your kitchen fridge, which food has got sulfur in it?
I don't know.
See, you're all looking lost for words. Cabbage got sulfur in it.
All right. Okay.
So आप cabbage का पत्ता ले लो और थोड़ा सा cabbage घस लो, पीस लो, put that in the thing and put that on your night on your knee and put a bandage on it. Leave overnight, your pain will go away. So it's a simple solution. Yes, that's part of Ayurveda, one of the treatment.
Red cabbage, isn't it?
No,
Huh?
the
Red
green.
Grating करके cabbage को पीस लो कसिए मशीन
Is
में.
it a red cabbage or green cabbage?
Yeah.
I'm color prejudiced. I don't mind any color will do. It's a sulfur we're looking for, just to get a sulfur. But खाने के लिए red cabbage is better than green cabbage because it gives you more beta carotene to promote vitamin A, which helps to balance your cell dying and so better prevention of cancer and other illness.
You know when you sorry, can I ask something? You know when you make your hello, Sarvanji? When you make your like how much candle wax do you put in your the camphor and the olive oil and the mustard oil?
You first heat the mustard oil.
Yeah.
And then you put the camphor in it and put the candle wax in it. It all melts. And then after you leave it cool down, it becomes like a jelly. When you liquid, you put that in some kind of container, let it go off. When it goes solid, it becomes like a candle, kind of wax kind of texture. And then you use that in the morning whenever you want to put that on your skin and body.
So you don't. There's no quantity that you put in, like equal amount of camphor.
No, there is a quantity. Swami is given a quantity, but I can't remember offhand. I can find it, come back to you. But just I'm a chef. जो खाना बनाते हैं कितना नमक डालना है कुछ पता नहीं है. हाथ से डालते हैं जो जाता है जो मिलता है डाल देते हैं.
Just like desi. When we're cooking as well.
तड़का डाल देते हैं जो भी तड़का मिलता है डाल देते हैं.
No recipes. Thank you.
What are the points for swollen feet, please, Sarvanji?
Sorry, I didn't get it. Say that again, please.
What are the points to praise for the swollen feet? I've got a lot of water retention problem.
Water retention best है हल्दी, मेथी, ginger powder. तीनों का powder खरीद लें 100 ग्राम का. Mix them together and take a half teaspoon morning and evening. That will, for female, it's very important to get them because you got a lot of water retention. That will get the water retention away from your body. And also doing all the exercise, improve your circulation. That's what we're trying to do with all the pranayam and asana, what we're doing, give you energy. And also, if you have a pencil like that, just rub over your hand when we're sitting, that will improve circulation as well. You don't have to know. Sometimes we go into too much detail. Don't go into too much detail. Just do it. करते रहो और फायदा मिलते रहेगा. We ask too many questions. We kind of and then you don't do it at all. करोगे करो योग रहो निरोग. That's what the Swamiji says. करना पड़ेगा.
What did you say? Methi, haldi, and what else?
Ginger.
Ginger. But I
Ginger का powder मिल जाता है बाजार में. You can buy the powder in the shop anyway, in any Asian shop, and you can use that. Mix them together and take half teaspoon morning and evening. So also good for you is cinnamon powder. ताज बोलते हैं, which is good for you. And also eating, and the problem is you have to drink plenty of water. Sometimes people, because water retention, they don't drink enough water.
Yeah.
That makes it worse. So body try to store the water. And that's why you water to get rid of water. That makes sense?
For this, for backache, where is the best point to use the gun at?
Backache, again, if you're using the Swamiji technique to promote health, then you do it just along. That's your spine.
Yes, yeah.
That's L4, L5 with the meat, and then it goes to the neck. It's spondylitis. It's like that's where it goes across. So if you go, that's your middle point with joint. That's your sciatica pain.
Okay.
And you go up, it goes to the top, and then goes from here to neck. That's the neckline. If you pain the neck, that's the pain. That's the Swamiji teaching. If you go into physiotherapy, if you go in the back, middle of the ring finger and the middle finger and the ring finger, that channel is your spine. So all you do is you go right along that channel, middle channel, for 1 minute.
Okay.
Depending on which side. Both hands.
Okay.
Right hand, left hand, depending on which side you're doing.
Okay, lovely.
So how would you do the hand one? Do you do the opposite or the same? Because remember, acupressure, face crosses over, front is same, and the back is opposite. So if I'm pain in the right leg, which hand would you use?
Left.
Left.
That's so even if you have also acupressure में यही बताते हैं, if you have a bad knee pain on the right leg, ये point बच्चा है. When you press the point where the middle point there, that also gets rid of the pain there, and also across here in the middle when you join and this to middle of that point. That's L4 point, large intestine number 4. These are all meridian channels. That's what I'm doing. I'm not telling you too much information, not to confuse you. But if you look at the book, which when you buy the pin gun, that has got all the meridian on it. That's all those points on it. So I'm not telling you, and also middle of this point where the lung point is very good for back pain.
Is it in the Patanjali book?
No. In the when you buy the, this, when you buy this pin gun thing, it's in there.
You got this.
The book.
Okay. Oh, it's only all the points that you press, yeah?
Yeah, they're all the meridian channels. But you can Google it and find it as well. If you Google it, you can see all the different meridian where they are. They'll give you all the points to pray. Because that's why they come to surface. Otherwise, you deeper inside, you can't get access to them.
Bhai, you know what? Sorry, can I speak Hindi? Okay, भैया, you know what? जब मैंने आपसे मंगवाया था ना ये, जब आपने मुझे सेंड किया, तो इससे पहले मेरी बैक में बहुत दर्द था, और जब भी मैं जीपी को फोन करूं तो मुझे क्या बोलते कि हम तुझे कुछ नहीं कर सकते, इतना सीवियर पेन था. तो जीपी ने मुझे क्या कहा पता है कि तू जाके कैजुअलिटी में होके आ जा, फिर वो लोग तुझे एमआरआई करेंगे. मैं बोली जीपी को कि तू मुझे रिफेर कर, तो उसने कहा नहीं हम नहीं करते, तू ट्रस्ट कर. मैं सच कहती हूँ, जब मैं आपने मुझे ये पेन भेजा और मैंने देखा कि ना एक्यूपंक्चर, वो जो हमारी मिडिल फिंगर के बाद, वो जो मिडिल फिंगर के बाद वो जो है ना वहां प्रेस किया, ट्रस्ट करो मेरी फिंगर, मेरा बैक पेन चला गया.
That's good, excellent, well done.
चला गया.
Thank you very much.
Such a good pen. I will recommend everybody to buy this pen.
I know it works. That's why हम लोग कितने लोग हमको बोल रहे हैं कि I'm running a business. This is not my business. If I make money, to find other way.
मैं एक बात को, मैं ज़ेरा भाई को मैं इतनी दुआ देती हूँ कि उसने आपके साथ मुझे इंट्रोड्यूस करवाया, और जब उसके घर पे गई तो उसने मुझे ये पेन दिखाई, और मैं जब आपको मैंने फोन पे बताया कि मुझे वो पेन चाहिए और आपने मुझे भेजा, मेरी बैक की दर्द चली गई. इतनी सीवियर बैक पेन थी कि मुझसे ना बैठा जाता था, ना सुला जाता था. कुछ भी नहीं यहाँ था I can't bend it was ना अब पता है मैं कल भी इतना वॉक करके आई मुझे दर्द नहीं हुआ बैक में आज भी मैं वॉक करके अभी आई हूँ और मैं ये कह रही हूँ कि thank you very much for this pain.
Fatma ji, thank you very much for your nice comment. You know, in the day, it's good to hear from people who have benefited because that's what gives the people, other people confidence that the product is right. I won't recommend anything which is not good for you. Put it that way. You are like
just I want another
female.
one. Can you? I missed that one. You know, you was talking about the frozen shoulder. I have a frozen shoulder. So what to do with the frozen shoulder with this pain? Can you repeat, please?
Yes, I can repeat. No problem. I will do that. The problem is frozen shoulder. One of the best one exercises you can do if you do namaste behind your back.
Oh, okay.
And do the Kapalbhati. That will.
Okay.
That's one. Second one is you twist your hand like this. And do Kapalbhati.
Oh.
And do the opposite. And third one is I can't do it. I used to do it, but not anymore. Putting your hand behind your back, another hand to grab it.
I can't do it.
I know I
can't do
can't
it.
do
That's
it. But use a towel or something to pull even napkin and then even होता नहीं कोई बात नहीं नाटक कर लो ना नाटक करने में क्या होता है दिखाई तो पड़िया कर रहे हो कम से कम and do Kapalbhati. These three will help you to do that, and also frozen shoulder. The best way is just putting it on there on the collarbone, just around the collarbone, right around the collarbone. Obviously, this needs the only thing problem with this one, you have to do it on the skin. You can't use where the other one you used to do before. I don't have it here. And then this one I can do it on top of the cloth. This one, you have to press it. That's why I've damaged my nerve system because I'm doing so much that this.
So this is another pen now. This is another pen.
This is a medical equipment. You can buy them in pharmacy everywhere else. They cost about 30 pounds. I have 70 of them as well. But I stopped promoting this now because for people our age, this is too much of work. We can't do it. But this is a battery in it, so it works automatically. You don't have to press it. You just touch it. That's it. So this is much more user friendly.
Easier. It's fine. I can. मैंने देखा कि वो खुद ब खुद वो नर्व्स को ढूंढ लेता है ये पेन.
That's right. Yeah, so find the energy channel and promote it. Thank you, Fatma ji.
Thank you.
Anybody else? Any question you want to ask?
Does it dissolve blood clots?
Depending on where the blood clot is, when you have blood clot, what I do is the thing is you don't want blood clot to move either because that might move and go to your brain or something, give you a stroke as well. So you have to be careful exactly what you're trying to do. So blood clot will prevent having a blood clot by doing it. If somebody doing it here and touching your finger and the hand, the blood can flow faster and promote that thing. So it's like if you have a thyroid problem, put it there to improve your thyroid gland. If you have a lung problem, put it in the lung point. So this can do a lot of things. You just see. I said to you, nobody did a research on this. I've been working on this for the last 15 years. So even now, people who sell them, they put the acupressure. Before they didn't put meridian diagram on it. Now they do that as well. So obviously this saw the amount of sale I was doing, and they tend to use that. Even this pen, they didn't used to send. Now they send the acupressure drawing with it. Which point to press for which kind of problem. With the pen, when you buy the pen, you get that with the before you didn't. Before it was just a pen you got, and it used to cost. Initially, I bought that for 70 odd pounds. Now she's going down to including postage 30 pounds. I have them as well. If somebody wants this one, you're welcome to it, no problem. But I won't be promoting it anymore. But I still have I still got 70 of them lying. So it's kind of my money is stuck. It doesn't matter. I can't promote something I don't believe in anymore now. I believe in this, and that's what I'm trying to promote.
Can you please explain, about this? If you got pain on the right, you press on the left. I'm a bit confused about that. Please, can you kindly
sorry, say that again.
You said that if you got pain on the right side, you have to press on the left hand or something. So
what happens is
can you kindly explain?
Yeah, leg is in opposite side. If you're starting a pain on left leg, you press the right hand.
Ah, okay.
And if it's right leg, then left hand. That's what I'm trying to say.
All right, okay. So if I got pain in the right knee, I press on the left.
Yes, that's right. That's it.
Okay, thank you very much.
And also, I'll tell you, I've been talking in every acupressure class about even what's the worst illness you have heard of? Breast cancer. That's one of the most common in the world today, isn't it? If you press this point below the palm of your hand, let me just highlight that in here. So, middle palm of your hand there and there. And same thing with this hand and this hand. Which is more sore, your right hand or left hand? Or neither?
Left.
Right. If your left is sore, that's telling me your left lymphatic system is weaker than right. So anytime later on, if you ever have any problem due to the lump forming in your body, it will happen on the left side. So one thing, cancer doesn't come overnight. It gives you plenty of warning. So if the left side is weaker, what you have to do, you have to make the left side stronger. So how would you do that? So you just press this point there and pump it like that. That's your lymphatic system, forefinger. And that makes a pump and the lymph fluid flow faster, WBC, white blood cell, and remove all the dead cell from the body.
Can you put a close up, please? I can't see the point properly. Please.
But you can do that with yourself as well. I think okay. So you press it there.
Right in the middle. Yeah. Three fingers.
Three fingers above the line.
And in the middle.
Yeah.
On the nerve. Yeah.
Just the middle, just middle of the channel, the blood channel.
Yeah. Okay.
This one. Both hands, right and left. Prevention. We can go and I said to you, I'll go and give a lecture in the cancer hospital. I've done that as well, where I could diagnose cancer, what cancer they had by pressing the hand.
Oh.
If you have a breast here, uterus, somebody's saying, I can't see myself. If you press between the palm of hand there, there will be hole there. If that's paining, if you're female, that tells you you have uterus fibrosis. Might be not big enough, might be very small. If you go to doctor, he might scan you and say to you, no, you're okay, no problem. Once it has become certain size, then they will send you, refer you to the hospital for surgery and certain thing like that. And if you're male, if it's paining there, that tells me you have large prostate. So all I'm saying is, acupressure is a way of finding what illness you have or going to have. If I press nighttime here is paining, that tells me tomorrow morning you have a sore throat. So I start gargling with haldi and salt water and make sure I don't get it. So once you know the problem, you can remedy it. That's what I'm trying to say. So the best thing for a healthy person is to do a risk assessment. Look at your family history. What your mother had, what your father had, what illness they had. Chance of you getting will be 70%. What you have to do is do the right thing to make sure you don't get it. By eating the right food, doing the right pranayam, doing the asana, exercise, everything else. And that's what it's all about. Prevention is better than cure. But you have to put some resources to it. It just won't happen. It's not like it's like an intermittent fasting, good bowel movement, going for 10,000 walk every day, cleaning your bowel, good bowel movement, mouth hygiene, nasal hygiene, all these things play the important part. That's what I've been talking for a whole year, every lecture and different things. But in the day, it all comes down to the same thing. Then what illness you have, your problem will be similar, kind of idea. Does that make sense?
Yeah. Good.
Anything else anybody wants to ask before we could then close the thing, please off?
Pain in the
sorry.
on the arch of the foot. If you have pain there,
that's what I'm saying. Use the steel golf ball or something and rock your feet on that. That will because it creates an arch in your feet. That's because if you don't have an arch, that's when you have a problem. Sometimes it kind of suits you wear, or you're standing every day throughout the day. That's what the cause the problem is.
Okay.
I have this.
What about burning feet at night time?
That's due to the neck problem, your posture. That's what I'm saying to you. You'll get burning sensations in your feet with people who have spondylitis, like a damaged nerve system. It's a neuro problem. Even I was listening to Soalji lecture but doctor was present talking about vaccine. And so one of the ladies said when she got vaccine, her nerve was itching, shaking like this. So what was so obviously he said you should report to the doctor and report to the center where you had the vaccine. That's fair enough. But to me, I can tell you, she probably works in the computer or something like that. So she had those problems anyway. But then when they get the injection, it might highlight it. It might hit the nerve, which causes that problem and kind of come back on it. That's what's causing it. So really, sometimes doctors are good at what they do. Don't get me wrong. But sometimes they don't have time to go to the bottom of the cause. They just have a quick solution. They try to systematically, they try to fix you. While in Ayurveda, we're trying to go to the root of the problem. Until I find, that's why I need to know more. Once you tell me the problem, I want to find what kind of job you do, how many children you have. All this helps me to come to the right conclusion. When somebody comes to me physically, if I came to say Neruji to do her treatment, then once I hold her hand, she's younger than me, so hand should be warmer. If your hand is cooler, that tells me her circulation is not good. Then I looked at the back eye, that tells me she might have, if it's a dark eye, that tells me might be a kidney problem, might be water retention, something like that happening. Back the nail, obviously in females, sometimes you can't tell with a lot of nail varnish and all that. If you don't have a nail varnish, you can tell if the calcium deficit or not, if nail is chewed up or something not right. So I'm saying a lot of things you can tell by observation. And then you do the acupressure to find out and eliminate what you don't have. And then you come to my final conclusion. And I found 70 to 80% I was accurate every time I did somebody with what diagnosis. I didn't know what illness they had. I could tell them they were diabetes or they had a kidney problem or they had arthritis of the shoulder, whatever it was, just by pressing acupressure. The thing is, that's what I'm trying to teach all my family, all my friends, so they can do themselves and try to prevent happening. Prevention is better than cure. So really, acupressure is simple. It doesn't harm you anyway, and you have to believe in it, And recently, yesterday, in fact, Banu, she gave me to take her class. I took a class for her members as well. Hopefully, they enjoyed it as well. And I'm willing to go anywhere. Anybody wants me to take any class anywhere else. Because in the day, it's all about promoting health. It's not about promoting me. I'm nothing. I'm only a small fish in the sea. I'm doing nothing. It's in the day, it's trying to, what Swamiji is trying to say, networking. The 1 becomes 10, 10 becomes 100, 100 becomes 1,000, 1,000 becomes 100,000, and so on. This is how we make the whole world healthy. And we are all part of the equation.
What about continuous numbness in feet? Please, what is the
numbness in feet? Again, depend what kind of work you do. You tell me, please.
I'm retired.
I know. पहले क्या करते थे पर?
पहले मैं काम करती थी.
हम तो करती डाली. क्या काम करती थी? क्या काम करती थी?
मैं सिविल सर्वेंट एडमिनिस्ट्रेशन काम करती थी मैं.
कंप्यूटर में लिखा पड़े.
हाँ, कंप्यूटर में एडमिनिस्ट्रेशन.
तो that's your posture. That's why जब आप young थे तो आपको पता नहीं चला. जैसे जो उम्र बढ़ा, वो सब symptom आपके सामने आ गया. And problem is आपका more or less posture problem है, neuro problem है. That's why you have burning sensation in your feet. So really उसमें आप तलवा भी है ना, थम से रोज मसाज कीजिए, मस्टर्ड ऑयल डाल के फायदा होगा. या एलोवेरा जेल लगा के कीजिए ऐसे करके. And also putting gun in your neck and your thumb will help. Problem यहाँ पे है, कभी-कभी दर्द कहीं और है, कारण कहीं और है. A lot of people have prostate problem or uterus fibrosis. उनका heel दुखेगा, उनका pain यहाँ होगा. So you go to doctor, he just gives a steroid, painkiller for the heel. But if he doesn't tell you, it's due to pain. When you eat the tablet, pain goes away, and then the effect comes back again because your uterus fibrosis or prostate is still there. So really, you have to go to the root of the problem. That's what I'm trying to say to you.
Yes. How about one of these, Sarwanji? Is for the foot.
Yeah, that's the spiky. That's
for the
that's it. You can do that sitting down. You can put a roll on the feet on the night time when you're sitting on the bed. You can. So that's very good for that.
Yeah,
there's a lot of different tools. There's a lot of different tools. People are producing it all the time.
I've got this one for to massage.
That's all. आपका तो बड़ा tool है, हमारा छोटा tool है. हम छोटा tool.
Shravanji, What about twitch in the eye, one eye? What is that to do with? Is there any point?
Again, it's a nerve problem. Again, it's a neuro problem. Because nerve connecting to the thing, to the vagus nerve or through the thing, it's affecting your eyes. It's like a, so really throwing cold water over your eyes every night and morning, that will help as well. Also a lot of vitamin C, beta carotene, like carrot and certain things, juice and all that. And also doing in your eye point, in the which eye, right or left eye?
Left eye.
So you go on the right hand and you put it onto your eye point there, just put it there. If somebody else is doing it, put one hand there, another hand on the eye, right eye. Right, left eye, isn't it? So right
Left
hand on left half mein yahan rakhna hai. So current will, you feel the vibration in your eyes as well, and your I can guarantee your flickering will go away.
Oh, I see. Okay, so this is the eye point in your hand and the one hand in the near the eye.
आप नहीं कर सकते, बल्कि आपके husband जब कोई आपको यहाँ पे हाथ के eyes point डाल देंगे यहाँ पे, right hand.
Yeah.
And left hand, दूसरा हाथ से एक finger आँख में यहाँ डाल देंगे, just to massage it.
Okay.
And that will, you feel the vibration there. Also, you'll feel the eyes, and suddenly you'll find. I'll tell you a story again. I did somebody was a jeweler. He went blind almost. He just couldn't see at all. So I did acupressure for his eyes with this gun. Not that time I was using this gun, obviously. Exactly same thing. And then I left him afterward, and then I was going to the airport to catch the flight. Then this guy came driving past me faster. And he stopped me and said, "Apne jo bhi kiya, humko, I can see some light through my eyes now." So all I'm saying to you, that's how good it is. That's how good it is.
That's great. Thanks a lot.
No, thank you. No,
भैया ग्लूकोमा के लिए, भैया ग्लूकोमा के लिए.
देखो, हम डॉक्टर नहीं है, ग्लूकोमा तो नाम तो बड़ा है. नहीं, same thing exactly.
माशाल्लाह आप डॉक्टर से भी अच्छे हो.
नहीं, ऐसा कोई बात नहीं. We need doctor. My father was a doctor. I respect them. We need them. They are the first. They are the good one for any emergency. If you have an accident, you have a fall, you have a fracture, any surgery, you need them. So we don't they have your old medical history. So you should always consult them. Let them know what you're doing. Kind of. That's my suggestion. Don't try to take control of your health in your own life. But same time, prevention is better than cure. So before you go to doctor, try to heal yourself naturally by the food product, by the exercise, pranayam, acupressure, mudra, and so on. Very important. Also, for any joint pain, one of the best exercises is the Vayu Mudra. Sorry, that will release any pain at all. Index finger, base of the thumb. Let me just highlight it. Just Vayu Mudra. That will release any pain, any kind of pain at all. Another one is, if you take the index finger and thumb finger, where the index finger meets there, just press that point. That makes the whole body. It's like a pain for whole body completely. Both times. I can do that with the gun as well. And last but not the least, to give your body more energy, acupressure the adrenal gland, which is if you follow your belly button right onto the back, either side of your spine, there's the adrenal gland which gives the body the energy, and tap it like that. The thing is, what we're doing in the morning for lung exercise, that will become a norm. You need to do that daily, and I can guarantee any allergy, any kind of symptom you have will go away. Because once you have oxygenated blood, automatically every organ gets more energetic. But make sure you're not anemic. You don't lack of B12. So make sure your food needs to be right. If you're anemic, you lack of B12, then obviously you must be seeing doctor. He will prescribe you some injection or some tablet for B12. B12 is very important for giving you the body to absorb more oxygen and gives you more oxygenated blood and promote health. So I know sometimes I might be repeating some of the things, but I'm sorry. Just whatever comes to my head, I like to.
That's great, yeah.
Okay. It's good you are repeating because that's how we remember it. Yeah.
No, thank you. No, but anytime you don't understand something, just ask me. I don't mind repeating it or writing to you as well.
Yeah.
Thank you very much for your help.
Thank you very much. Have a lovely evening, and hopefully tomorrow I've got two classes. I'm doing with Jyoti and taking my class, and then evening as well, 5 to 6:45. Let's see what's going to happen. And I'm still surviving or not. I'll tell you tomorrow morning. You'll know.
In the same class, 5:45 acupressure?
No, 5:45 with. I think I'm getting Jyoti to take a class, but I'll be there with her, kind of to promote the whole pranayama, yoga and pranayama and asana in the kind of proper way, professional way, not like the way I do it, in a bit of fun, like I do like a fun. They do it more professionally. They're better teachers for me.
You're taking a class 9:30 tomorrow morning, yes?
Yeah, tomorrow morning is 9:30. Again, I'll be taking a class. I've got 2 classes in the morning. I've got one before that as well.
My God, you're exhausted.
That's why in the afternoon this morning I had 2 classes also. I slept for 2 hours. I slept for 2 hours in the afternoon.
Thank you very much, Raman.
Thank you very much. Have a lovely
Thank
evening.
you.
Thank you for all your support. Thank you very much.
Thank you.
Anybody got any problem, come back to me. No problem. I'm there to help you anyway. So Varsaji, Maniji, Minaji.
Thank you.
May God bless you. Thank you very much for your help.
Thank you so
bless
much.
you,
Thank you, Bhaiya.
बोलिए.
Thank you, Bhaiya.
Oh, thank you, बोले ना. Thank you very much. Thank you, Fatma ji. Thank you for your nice
God
words.
bless you.
Thank you, Leena ji. Thank you.
Thank you.
Om Raji.